Hello everyone, my name is Xochitl Valladares and today I will be presenting about von Willebrand disease. So what is von Willebrand disease? Von Willebrand disease is a bleeding disorder that affects the blood's ability to clot due to a deficiency of the von Willebrand factor. Essentially, it is a disease with missing clotting protein in the blood and it is an inherited blood bleeding disorder. Some background facts. Dr. Erich Adolf von Willebrand discovered von Willebrand disease in 1924. Von Willebrand observed a family with a bleeding disorder that was different from hemophilia. He studied the family's bleeding history and performed laboratory tests. He concluded ultimately that plasma factor was involved in the disorder. And he pretty much concluded and published his findings in 1926. So demographics. Von Willebrand disease is the most common inherited bleeding disorder worldwide. It affects both males and females from all racial backgrounds. Globally, von Willebrand disease affects an estimate of 23 to 110 in 1 million people. The numbers vary because people may have bleeding issues but aren't diagnosed with von Willebrand disease. In some cases, people have bleeding issues and for many years before they have a firm diagnosis. However, I do want to point out that women are more likely to experience symptoms of von Willebrand disease because of the increased bleeding in menstrual periods during pregnancy or after childbirth. So, anatomy and physiology. Von Willebrand disease is a genetic disorder caused by a missing or defective clotting protein. People with von Willebrand disease have problems with a protein in the blood called von Willebrand factor, which is these little squares right here, that helps control bleeding. They do not have enough of that protein or it does not work the way it should be. For many people with von Willebrand disease, it takes longer for blood to clot and for bleeding to stop. Here's why. It involves the endothelial cell, the platelets, which are these red circle. Platelets are tiny fragments that stick to the wall of the damaged blood vessels to control bleeding. The von Willebrand factors, which is regular little squares, blue squares. The subendothelial collagen, which is this yellow thing right here. There are special receptors for platelets. As soon as platelets come into contact with the von Willebrand factors, they get attached with the help of GP1B. This attachment is called platelet adhesion, which is a connection with the platelets and the von Willebrand factors, which shows right here in this image. If the von Willebrand factor is absent or defective, there will be an abnormal or defective platelet adhesion. Von Willebrand also carries factor 8, which is another protein that helps the clotting. So adhesion 8 and von Willebrand factors work together for the blood clot. Because of von Willebrand factor is a large, complex, heavily modified glycoprotein with more than one role in homeostasis. Disorders involving defective or deficient von Willebrand factors can present with spectrums of severity. The most common generic disorder in von Willebrand disease encompasses 3 types. So there are 3 types of von Willebrand disease and the 4 subtypes inherited in an autosomal dominant pattern. So in type 1, which is right here, this one, von Willebrand disease, the body has lower than normal levels of von Willebrand factors and potentially low levels of factor 8, another clotting protein, as I mentioned before. In type 2, the body makes normal amounts of von Willebrand factors, but it does not work the way it should be, and it also includes 4 different subtypes. In type 3, which is this one right here, the body makes very little or none of von Willebrand factors and has very low levels of factor 8. And this one is generally considered to be the most severe type of von Willebrand disorder. And it's this one right here. As you can tell, this one has way fewer von Willebrand factors and factories compared to the other two. Okay, some symptoms. There's various different symptoms, but the most common symptoms are having nosebleeds often or difficulties to stop bleeding, easy bruising, very heavy or long menstrual period, minor cuts, bleeding from the gums, bleeding after injury surgery, of dental work, continues to bleed for a long time, or heavy prolonged bleeding after giving birth. Diagnosis and treatment. So many people in von Willebrand disease symptoms are mild and they may not be diagnosed until they have a major bleeding problem, for example, from surgery or injury. Some diagnosed von Willebrand involves a personal history of bleeding or bruising, family history with abnormal bleeding. Special laboratory blood tests are conducted to pretty much diagnose you with von Willebrand disease, and also genetic testing. Some treatment involve desmopressin, which is a synthetic hormone, and it works by releasing the body stored von Willebrand factors and factor VIII into the bloodstream to help blood clot. Fibrin glue is another option. It is a medical gel made from fibrinogen and thrombin, which are proteins in the body that helps blood to clot. And lastly, hormonal treatment, which is your doctor will probably prescribe you birth control pills or get you on the IUD for women that have heavily menstrual bleeding, and those hormones can help increase the von Willebrand factors and factor VIII levels. And here are my references, and that concludes my presentation. Thank you so much for listening.